So when is a shoulder problem not actually a shoulder problem? The answer is when it's coming from your neck. So one of the things that we've been seeing a lot here in the clinic lately is a lot of shoulder pain. People coming in with pain that's going on kind of around this area in the shoulder, but they've been coming in with a clean MRI. They've done x-rays, they've done scans. They all tend up being negative. So the x-rays are fine, no fractures. The scans show that the joint is all okay. There's no tears in the tendons, but they're still having all this inexplicable pain going on, especially when they're trying to go into any kind of overhead movements. So what's going on here? So a lot of times we'll check these things out. We'll see that actually there is pretty good full range of motion on the shoulder passively. So where's the problem coming from? When we start digging around, the problems that we find sometimes is in this area of a muscle called levator scapula. So you can take a look at this little guy right here, and you can see how it runs from the edge of your shoulder blade all the way up into the neck. So what we'll find is that there's a lot of like knotted tight areas like all the way up in the top here. You'll see this a lot with people that are kind of sitting a lot, they're driving, they're doing a lot of computer work, their shoulders are always hiking up this way. And then they take off those 8 hours of work and then they decide that they're going to go to the gym and just send it. So you end up getting that impingy pain there because what that levator scapula muscle does is it's going to attach to this little edge of my shoulder blade right here. And if it's right there, it's going to pull up into my neck. It's going to lift that shoulder up in this direction, and it also kind of tilts it a little bit that way towards my shoulder. So if now all of a sudden this little bony spot here is now sitting a little bit lower than what we expect it to be, and now the head of my humeral head, my arm bone here, is kind of getting in the way, now there's a little bit of a pinch that's happening here, especially when I start trying to raise that up overhead. We end up getting a lot of grinding, a lot of impingement. Sometimes you start wearing down the cartilage in that joint. You can pinch the tendons of the rotator cuff as it patches through there too. So all that's not good. But it all ends up being not actually a shoulder problem. The problem is coming from a little bit closer up towards your neck. So what do we do about this kind of thing? So one of the things I like to do here, and it's a pretty simple fix. There's a lot that can be done actually, but there's manual work, there's dry needling, there's all kinds of stuff that we can do. But one of the most simple things I like to help people do is just go get yourself a lacrosse ball, and you just need a pillowcase or a sock, something like that works too. But what I'll do is I will take said lacrosse ball. You can use a tennis ball too, but tennis balls tend to be a little bit too squishy in this case. I want something that's going to be a little bit more solid rubber that has a little bit of give, but not much. And I'm going to take that lacrosse ball, I'm going to put it in my pillowcase. I'm going to let that come all the way down to the end. We roll it up a little bit, and now we've got our little mobilization tool. I am going to flip that little ball right over my shoulder. We're going to get it right into the spot of where that levator scapula muscle lives. So I get it like kind of right about that corner of my shoulder blade. I'm going to get right into that meaty spot. You'll probably find some tenderness there. So now I'm going to take that area here too, and I'm going to go right up against the wall with it. And as you can hunt around, you will find some little nasty spots back there. Once you find them, you will know. So once I got that kind of locked in place, there we go. I'm going to kind of hold that in there, and I will just very slowly move around a little bit. So I'm going to kind of go a little bit to the left, a little bit to the right, a little bit up, a little bit down. You might even feel like some sharp things that will kind of shoot up your neck, maybe a little bit down your shoulder too. Ease off on the tension if that's the case. I will take some nice, good deep breaths because now we're expanding the rib cage. Expanding the rib cage is going to help stretch some of those deeper muscle tissues. And I will do in and out as we sink in. As I breathe out, I'm going to try to sink into that a little bit more. I'm also going to lean my head a little bit away. If I lean my head away, I'm going to put a little bit more stretch onto that levator scapula muscle. And even go a little bit forward, almost like I'm kind of looking over in this direction here. As I work this for about a minute or two, I should start to feel some release going on. Things start to let go. I can let my shoulder kind of wiggle around a little bit, and then you might see that that overhead range of motion is starting to do a little bit better. So what this all does is just kind of releases the scapular mechanics there, lets things kind of get moving a little bit easier. And then if you work consistently at this, you should start seeing some good changes going on in that tissue, hopefully less shoulder pain going on. And sometimes people even say headaches and things like that start to clear up a little bit too. But that is a basic levator scapula mobilization. Go ahead and start working that into your routine, especially if you're a desk worker, you're sitting around, you're doing a lot of driving, your shoulders end up here. You want to kind of loosen those things up and then start actively trying to pull those shoulders back and together here. So all that stuff is going to work on you. If you're still having trouble with any of that, please hit our notifications and get a hold of us, and we will be able to communicate.